Hey there, Dr. Todd Cameron here, GP. Today I want to chat to you about the very recent TGA approval of the AstraZeneca Oxford vaccine for use in Australia. And the key thing here is that this is part of the 1B phase of the Australian government vaccine rollout and beyond. The 1A phase is, of course, the Pfizer BioNTech, and that's around about 10 million doses. That is mostly going to frontline workers and in aged care facilities to workers and aged care residents. 1B is around 14.8 million doses that are expecting to be delivered. That's going to mostly be through general practice, and this includes Australians that are 70 and above, Aboriginal and Torres Strait Islanders that are 55 and above, healthcare workers that are not included in that 1A wave will be immunised here, and critical and high-risk workers such as defence, police, meat workers, emergency services, etc. The AstraZeneca vaccine has been permitted for use in Australians over 18, not below that at this point in time. You may have heard some press around, people talking about the different rates of efficacy for COVID vaccines and kind of creating a hierarchy, like there's some good ones and less good ones. The truth is they are all 100% or very close to 100% in preventing severe COVID and hospitalisation. After all, that's the main thing we're all worried about, our hospital system becoming overwhelmed. They all have variable rates of how well they affect minor COVID or even whether or not it's able to be spread. But the reality is what we want to do is prevent severe COVID and hospitalizations from COVID. So that is a really, really important bonus for all vaccines. Now, the dosing interval is 2 doses, 12 weeks apart. It can be as short as 4 weeks if there was a reason, such as someone starting chemotherapy or being forced to travel, but 12 weeks is the default setting that is going to be in play. So what do you need to do? Well, make sure that you read all of the available literature on this and that you're comfortable that when your time comes up, you will take the vaccine. This is really interesting. We had a conversation amongst the GP team. I asked everybody whether they would take this vaccine if it was offered to them. 100% of hands went up very quickly. I was excited to see. And so what we're really going to need you to do is when your turn comes, we need you to be ready to act. And there's a couple of things you can do to speed that up. The first thing is stay tuned to the channels that suit you. That might be here. If this is in YouTube, follow a YouTube channel. If it's in Facebook, then again, follow that Facebook page. That way you'll get information as it comes to hand. We will be emailing you and texting you when we know that it's your turn. To make life easier for you, you can download our appointment app, and there will be a link around this video that allows you to do that just to speed things up. You can do that on Google or Apple, of course, and let's keep the information flowing. We'll let you know more as we know more, but it's exciting news that we have access to a vaccine that we know is highly effective. Bye.